Hello, everyone. Good evening. Thank you for joining us today. My name is Alex Preissig, and I'm the Clinical Sciences Student Representative of the Alumni Council. We are joined today for this session of Rounds with the Council by Dr. Jana Price, who graduated in 2005 from RUSM. Today, Dr. Price will be giving a lecture about artificial intelligence in medicine and the future of AI. Dr. Price, the floor is yours.
First of all, hi everybody. Appreciate those who joined. This is not expected to be a monologue, and the beauty about the topic that we're gonna discuss together is that whatever I say today may or may not be applicable tomorrow. That's how rapidly things are progressing. So what I wanted to do, rather than give you a lecture how AI focuses or changes the practices in a particular area, and I'll tell you briefly about myself in a second. I also want to talk to you about what is the impact and role of AI in graduate medical education, either at the undergrad level or med student level, resident, intern, fellow, you name it. Because to think that you're not impacted or it's okay, I learn about it later. Let me worry about my exams in step one and step two. Let me get into the residency and then we'll talk about it. You're already behind the game. Because it is not that AI will have an impact. AI has an impact. So my invitation to everybody who is in medicine is rather than, question possible changes, there are pluses and minuses because nothing is perfect. My strong recommendation is to embrace it. And if you were to ask this question to me about 10 years ago, 15 years ago, that I would be incorporating technology actively in my clinical practices and in research and QI and so on and so forth, I would probably maybe laugh at you. And the reason is because, like many of us, I was trained in the era of very traditional medicine when nothing is valuable and still holds the case, by the way, that the patient to provider interaction, physical examination, and if you do not have a diagnosis or differential diagnosis by the time you complete history, or at least 50% of your differential diagnosis, maybe you have to go back to the textbooks and start from the scratch. But the specialty that I'm in was one of the first, if not the first, and actually is the first specialty that have been embracing AI for more than 10 years. It just has not been commercialized, has not been open to general public. It was mostly done on a somewhat experimental basis. So a little bit about myself, although this lecture is not about me. Um, I am a very proud specialist in infectious diseases with a specialty in immunocompromised transplant patients and global health/clinical epidemiology. I never thought I would be doing ID as a specialty. I always thought I'm going to go for GI. But one day, as a second year resident who already had application ready to go for the GI with a very high chances of getting the fellowship, we had a case that nobody can figure out. Anemia in a renal patient, dialysis patient that simply has not been improving on transfusions. So somebody said, well, why don't you call ID? So then I remember the ID attending who was doing the consultations in the middle of the night came to us and said, guys, and this is only, I want to be very clear, only after obtaining a very detailed history and completing very comprehensive physical, he basically pinpointed out to us to the 100% accuracy what was the diagnosis, where the issue was, and to me that was an eye-opening. And I went to my program director, a residency program director, and I said, you know what, forget about GI, I'm going for ID. And he said that I'm probably crazy because all applications for the fellowships are already in. I said, that's okay. It's very important to, to do what you're passionate about. And I'm glad I did that because it was the best decision I made. So that's very briefly about myself. I am in academic medicine all my life. Um, actively involved in research. And the reason how AI came into my life to somebody who never incorporated technology is as a specialist who was responsible for healthcare system that I work for, thinking about antimicrobial stewardship program. One of the issues was understanding that our clinical decision making is actually nothing but very sophisticated algorithm. An algorithm, as you can figure out, is a foundation of AI. The question is, how good is your AI, how good is your algorithm? How good are the questions that you're asking? Are you thinking about everything and not just being narrow-minded either to specialty that you represent or to approach that you perhaps taking in care? And what we've learned, building or revising rather protocols related in the infectious diseases antimicrobial stewardship program, that while it can be unique to the facility where you practice, there's a lot of commonalities. And when you put in these commonalities from facility to facility together, you start seeing trends. And this is what AI in reality is all about, reflecting and helping you, facilitating, expediting a little bit more in effective way, guiding you towards the proper utilization of algorithms. I don't think I'm going to say anything unusual when I say that AI will never replace physician. So the best approach that those of you on call in particular is understand that you're going to be working with AI in parallel, and hopefully decision making and the mindset and the way you think when you approach patient or any clinical issue, AI will be facilitating, but not necessarily thinking instead of you. So I'm going to use the quote of very famous, he's actually an oncologist who spent from the UK, who spent his entire life 25 years ago focusing on AI in early diagnosing CLLs. He said, you don't want to be a physician who relies on AI. You want to have a physician that asks AI for help. I think it's somewhat speaking to the virtue of it. We can move on to the next slide. And let's do part one, we can move on. We can also when we talk about the AI, we can discuss this. We can move on also. A very similar phrase, by the way. We can discuss AI, what AI does at different levels of training, because the goal is that every level of training, medical student, the undergrad in pre-med, intern, and so on and so forth, each year has different purposes in the training and, towards the becoming physician. And one can never be, a truly knowledgeable physician because it's a continuum of learning. And that's another thing that I kind of want to incorporate, something that perhaps you've heard before, but, we don't realize how important it is in our practices to cover bases. Because once you cover the bases, and bases are very fundamental, and the simpler is your mindset, the simpler is your methodologies, how you approach a problem, clear your brain, sort of speaking, the more successful one certainly will be. So if you're going to ask me what a person should do now who is currently in training, number one, uh, be aware, as I'm sure many of you are. Number two, seek actually training in AI in medicine. Medical schools, not every medical school, for right or wrong reasons, may be up to date with offering such training, and that's quite all right, because just like as you're going to be a fully established physicians, but for the most part, you have to continue self-education by driven enthusiasm, understanding what drives you, what is it that you want to learn, so you can supplement your fundamental knowledge base. Because once fundamentals will not change, obviously new diagnostics will come to the place, new treatment options, new technology, new surgical procedures, and that's fine. So embracing change is something that everybody should be passionate about and not necessarily be afraid. And when I talk about AI medicine, I don't necessarily talk about how fast you can type your notes or how quickly you can log in and look up the literature. It is important, but I'm talking about going a little bit deeper, how you can supplement AI in your clinical decision-making processes, and where in which forms of AI you would find AI being used in healthcare already. So invitation, so what's the lesson number one out of this lecture is be aware that AI is here. It's not like tomorrow, it's already here. A lot of smarter people than us already completed tremendous research for generations, and now we are pioneers. Actually, think of us as a global pioneers on a global medical platform, being in the United States, that we're able to incorporate this technology in our daily practices. That's number one. So embrace change and be comfortable with it. Number two, seek opportunities. And what do I mean by that? We all have been through the same shoes when you have, exams coming up, finals and midterms, when you have to secure research, when you have to apply for the residencies or fellowships, it's given. But in addition to that, you also have to understand what makes you competitive. And this is something that everybody, you literally, every day you should wake up with a mindset, how am I more competitive? How am I more knowledgeable than my peers, other organizations? What is it that I can do differently? And only by seeking skills and information, not just reading journals, but actually seeking to improve your own knowledge base, is how you become more resourceful to others. So what is it that you can do? If you're, as I said already, if your medical school does not necessarily offer the training, there's other venues you can use. You can complete certificate programs. And by the way, as a disclaimer, I don't have any stocks and I don't have any financial relationship with any organization, but that's why I'm very comfortable talking about this concept. You can seek certificate programs, and I believe the list is actually listed on the American Medical Association website. That's number one. Number two, you could actually reach out to the companies that have implemented already, technological companies that have implemented those changes in daily practices and seek internship opportunities, volunteer opportunities, shadowing opportunities. Remember, all of this is important not only when you apply to medical school, but when you continue the training. And the shadowing does not always has to be patient shadowing per se. Anything that incorporates clinical decision-making tree and research and QI and so forth will have a long-lasting impact. Also, do understand that the prominent, obviously, medical associations already have incorporated resources on their website, whether it's AMA, whether it's American Association of Family Practitioners, any specialty that you might be possibly considering as your future career. Seek being a part of that committees, either as a student representative or early trainee, early professional. There are plenty of opportunities to be engaged. Another, which I find very helpful for my trainees, recommendation, get involved in research. And it is not a brainer, and it's pretty much, given as a foundation that physicians and clinicians and clinical providers, I should say, should be involved in research to one degree or another, regardless if you choose a career of research physician. And why is that important? I don't think I'm going to say anything that you do not know. Having an inquiry mindset, and being comfortable testing things, obviously with a presumption of safety, is important. Otherwise, innovations will not happen, right? So do try to see if there are research opportunities and QI opportunities. A lot of projects, I should say, related to AI currently are sitting in the sphere of quality because we're trying to understand how the quality of care, and remember, this is a very large concept. Quality of care, it's not just necessarily how you diagnose and what medication you treat. It's a social component, whole health concept, which I hope this is not a new terminology to those on a call and beyond. So try to seek if there are nearby, wherever you do rotations, wherever you do training, wherever you do your electives, organizations that you're part of it, city or state healthcare organizations that we as trainees generally don't take it full advantage of without realizing that they're extraordinarily resourceful organizations that are pretty much free of charge at your fingertips. So seek participation in it either as an active form or at least on observatory volunteer basis. So this is the general approach how one I would recommend to take. While I do not necessarily, separate medicine by genders, there's a new direction in medicine, upskilling those who may not be fortunate during their training or upbringing to be familiar with technology, or maybe coming from the backgrounds where technology was not part of their cultural awareness. Again, there's a plenty of resources to go through that. That's in terms of resources. So that's the second take-home message. Get involved, not holistically, practically. Number three, understand that whatever you may get involved today may change next year, and that's the nature of technology. So keeping up with whatever interests you in terms of the AI is also very important. One cannot say that you are certified in the AI or whatever you want to be certified without understanding that this is a continuum of knowledge gaining, that's the foundation I want to establish. The third point I want to make it clear, kind of early in our brainstorming, is whatever you read, which obviously does not apply only to AI, be comfortable questioning the validity of the information that you read. And the slide above you, often what we see in media, for right or wrong reasons, which I'm not here to judge, very catchy titles. But do seek to go beyond, do seek to go deeper. Understanding methodologies is just like you would read a research paper, right? We do not read the abstract. We actually read the actual paper and make our own decisions, our own comments, our own observations, our own recommendations. So while it became popular, again, for reasons beyond my understanding fully for the last 10, 15 years, often relying on brief data that is in front of you, that's not the type of physician that we all want to be. We want to be detailed, we want to be thorough, we want to be careful, we want to be analytical, and we certainly don't want to be superficial. So I am confident in your analytical skills, appreciating that evaluate data in front of you, not just the numerical data, qualitative and quantitative data and presentations with your own brain, and do not necessarily rely on what you're being told. It's very, very important to have open mindset, particularly at the time of dramatic changes. And we are, whether we want it or not, we are living in a time of dramatic change, actually new way of living, if you will, how technology impacts every aspect of our life, personal and professional. And once again, this is not a wrong statement. This is not a negative statement. On opposite, when you are a part of the transformation, very few are luxurious to call themselves being part of that time frame in a history. We are. So I certainly salute everybody. Let me pause for a second before we go further. Any comments, any thoughts? Have you guys, for those on the call, have ever anybody experienced AI, uses AI, has different maybe perspective or general opinion on the notion of AI? Do you think AI is here to stay? And obviously, there's no right or wrong answer. So this is a conversation purposes only.
Yeah, I think I see it pretty regularly in the hospital. I know there's some platforms that are embracing AI, and the doctors will use them to find like journal articles and other point if they have a question. I don't remember the name of them off the top of my head right now, but I've seen them use different platforms that pull from PubMed and pull from highly accredited resources to give them a very quick answer as opposed to having to find it themselves. So I do know it's pretty much infiltrated the hospital systems already.
Okay, valid. Stay with this comment because I'm going to ask you the same question probably towards the end, in terms of the opinion. But thank you for the feedback. Any other takers? No. Okay, so let's move on. And I'll get back to the Alex's comment about using AI during the rounds, most common time, pulling something very quickly. Okay, next slide, please. So, when I said that AI has been here with us for a while, it's not my statement. I'm only summarizing the work that others done. Because not remember, obviously, when you try to Google something, by the time, the moment you start typing, Google's brain somewhat understands holistically what are you attempting to look for and completes the sentence or the phrase or the search for you. That's what AI does. That's the algorithmic mindset behind the AI. One can argue that AI is as good as the data being inputted because after all, somebody has to put the data. And guess who's putting the data? Humans, right? So in a way, which is nothing new, AI is extraordinarily sophisticated database for generations of data inputted by humans, which has its own pluses and minuses. But the Google search that we've been using for many, many years by now, that's a earlier version of AI, if you think about it. So you have been already using it, each one of us, unless you have not been using Google, which I don't think anybody would not. Next slide. So the reason I put the slide is not because I'm going to read it. I usually do not read slides during the lectures, but just to give you a perspective how proud I am of being a representative of the infectious diseases as a specialty of medicine. But on a more serious note, look at the dates. It all started from 1950s. And what I do want to bring your attention as to under which circumstances clinical AI started to being developed. And if you're going to look at 1970s and happy, there's plenty of data and literature to look deeper, but basically it started by looking as to the blood cultures, whether or not the blood cultures that we process, A, can be processed faster, or B, provide more generalized answers. And if there's a way to make decisions based on cultures early. That's basically, in a nutshell, I just summarized generations of research work, which not very nice of me, but at least you understand the foundations where it all started from. It actually started from ID. And ironically, many specialists, I mean, sometimes you have those doomsdays comments, this specialty will disappear, that specialty will disappear. I don't know if the word disappear is appropriate. Reassessment, readjustment, reimagining. I know it's a very popular term to use nowadays, but reimagining specialties is something that certainly one envisions. And I can tell about myself. I know for sure that the way I practice medicine will not be the same in 5 years. Some things I will not be doing, and I probably will be my prediction that I will be focusing more time on more complex issues requiring more complex thinking rather than straightforward, if you will, quote unquote, simple UTIs and simple pneumonias based on the risk stratification. So that's my prediction that humans will be utilizing their intellectual mindsets for more complexity of situations, regardless of the specialties and regardless of the skills. So machines can help us with the simpler tasks. For example, Alex said earlier, we use AI for literature search. And I'm not saying that literature search is easy, but it's certainly somewhat an easier task because you're trying to pull together the data that has already been published. So of course, why not use the technology rather than using hours and hours and hours of human resources on the tasks that can produce the same, and the keyword is the same, result in a matter of few minutes, okay? With its own downfall, which I'll discuss in a minute. And things started to progress after that in early 2000s when the deep learning really started to kick in. We started seeing AI being used in GI, and as a matter of fact, one of the softwares that was developed on discovering colon cancers early, which has been already implemented in practices. So I'm not saying anything that has not been implemented yet. We also see AI already being used very successfully in neurological disorders, understanding the predictions or risks of developing Parkinson's and Alzheimer's, as an example. And from now on, you're basically going to see articles published every day. Early prediction this, early prediction that, accuracy this, accuracy that, in each specialty, in each subspecialty. So I'm not saying that AI is here clinically only to identify issues early, although I'm not saying anything new. Prevention is better than the treatment, but also identifying risk factors, social components, right? Because remember, medicine is not only about medications and doses and tools and CAT scans and MRIs. Understanding the even impact of politics will have an impact on AI. Geography, mobility. Sorry, I suffer from allergies. So I want also to be clear that when you're going to think of what drives you in AI, which subspecialty within AI you're driven to, it is much more than just the early diagnosis or early detection, which is obviously important. For example, AI, and I'm jumping ahead, but AI is finding its tremendous utilization in hematology oncology, helping to customize for the patient the safest, the least complicated course of chemotherapy. So the another way to look at the AI is, are we definitely embracing the customized, individualized medicine? And answer is absolutely yes. Um, it doesn't fly anymore. And I'm using only as a holistic example, 40 milligrams of statin is good for everybody for cholesterol. Like those general statements probably will be dying, and we're going to be entering more and more and more monitoring patients on a continuum basis because of the softwares that has been developed, and offering very boutique and customized treatments and recommendations based on the patient's individual factors, clinically, socially, administratively, and financially, and so on and so forth. So as you can see, the spectrum at which AI has and will have further impact on healthcare delivery is much more than the pure clinical. Next slide, please. Again, we can move on. The issue of those slides was that the rapidity at which things are changing, it's very difficult to keep an eye and not only keep an eye, but also incorporate into the practice, because at the time that you're learning one thing, something else already pops up. Again, be comfortable knowing that as a physician, you will not know everything and you're not expected to know everything, but you're expected to understand that it will be changed. I guess that's the best decision that one can make. Okay, so remember, everybody who enters the field of physicians, not everybody goes for the direct patient care, right? And that's the beauty of the specialty, that you can utilize the skills that you're learning towards many, many other aspects of our lives. Whether it's a drug development in a pharmaceutical industry, whether it's becoming a health analyst for healthcare organizations, for the political government organizations, it's all important. For being, in a way, a data management consultant, and being a personal consultant or subject matter expert, obviously in addition to being in academia. So what is the take home of this message? That while we focus more on AI in clinical medicine, AI also finds and already found its way in other aspects of the healthcare. That's why I always encourage, rather than using the term clinical medicine, remember that you're actually being trained and you are in training for much larger and much wiser, much broader, much deeper degree than direct patient care. So reevaluate somewhat early in your course, perhaps what suits you better, because the earlier you would understand, this is my personal opinion, I'm certainly not imposing, but the earlier you want to understand what kind of career you're envisioning, the obviously the quicker you can gain the skills that necessary to practice what you want to be and be more useful for the society in general. So that's something that you might want to explore even very early in your training. Don't wait until you get a degree and complete with the training. So start analyzing, getting information, resources, go to different career fairs in different industries. Plenty of physicians actually work for the animal health business, because obviously there's a lot of demand and cross reaction between human and animal health, right? This is not something that comes intuitively. Intuitively, what comes to us is like, let me get to residency, maybe to the fellowship if this is my interest, and then I'll think what I want to do. Start early. Next. These are examples, and those kind of examples will pop up literally every day, if not a couple times a day. How proper MRIs were used, more sophisticated, I should say, more sophisticated MRIs were used to embrace precise diagnostic of pulmonary diseases. Next. Again, this is a cardiology example. The one on the bottom, I personally, this is one of my favorites, how hand drawings of the patients led to development of the software for predictions of neurological diseases, right? So that's another thing that you can start, putting your brain together. Do you want people's lifestyle? Uh, to be reflected, which is in the clinical decision making? Are you more interested in this part of the healthcare, aka risk factors, identification, genetic identifications, early markers, non-invasives, and you start separating what interests you more, preventive medicine or treatment? If this is treatment, is it acute or is it more ambulatory, or counseling or genetics? Because each specialty, no matter what you end up choosing or subspecialty, will have those subcategories incorporated in them. And that's something that we really don't get a full feel while we are in medical school and while we're in residency, because our direct, immediate, day-to-day goals are different. So my invitation to you is, and that's not something that I've developed, so I cannot take credit for it, but one of my mentors actually recommended for me to develop a goal book. It's actually called. What are your goals for the year? What are your goals for the month? What are your goals for the week? And what are the skills that you want to learn? And as you go through them, you start getting checked off. Did you achieve it, or you're behind, or your goals have changed? So I continue using the same strategy now with almost 20 years in clinical practice, and I find it absolutely amazing. I know what I do well, and I know what I can do better, or maybe what I should not do at all, because that's not who I am. That's not the skills that I have. Next. And by the way, as a side note, what I'm actually using AI right now, I'm trying utilizing AI to better analyze me, myself, and I. Who am I as a person? Who am I in clinician? And of what kind of focus I should have for the next decades of my practice. I will report it. I just started doing this. I will report it. This is a journey. It's going to take 3 months as a project, but I'm happy to report when I'll finish. One of those things that you see on your screen is DaVinci Robot. This is, while we use this term very casually, robotic surgery, right? The word robotic somehow has been taken out of context because yeah, machine assisted surgery, but that's exactly what AI does. Keep in mind, there's basically, so far, to the best of my knowledge, there's no surgery that can be completely done without physician. It is the machine that is being guided by the surgeon, but machine helps to work together as to what is the best location or precise location to do the surgery. So my take-home message, if you think AI will completely take over the medicine, look at the robotic surgeries that already has been probably more than 10 years, if not more, in a practice where they supplement what physicians do rather than completely take over. Next slide. Um, Not everybody will be practicing medicine with procedures, right? Obviously, there's many of them that simply don't have to. One of them is psychiatry. And I had a long discussion with my friend as to it's impossible to use psychiatry, AI in psychiatry, because it's very human interaction driven. And it is the case. But I don't know about you, but I'm going to include myself. I do not know anybody that has a perfect communication methodologies on forms or tools or sentences. We, whether we like it or not, but we always say things that we did not mean, things that we believe could have been said better. And yes, being a good communicator is a lifelong learning. Some of us do not even achieve that. Um, so one of the ways that my friend convinced me that I'm wrong, and I'm glad that he did, uh, utilizing AI in more intellect, more verbal specialties, such as, for example, clinical psychology or psychiatry, as I mentioned, by phrasing things more appropriately, more gentler, more rounded, as they say, more nurturing, which serves the purpose. Actually, one of the key purposes of medicine is obviously to be a good nurturer. So rephrasing the paragraphs that I have in front of you, if that were to be done by human, it's going to take days, rewriting, editing, put together a group of people that know how to do that, specialized expertise in medical communications. So AI did it all together. And I'm not saying that you're going to use ChatGPT to write away how you talk, how you write, how you speak, but looking at ways and consulting something like ChatGPT for different ways to present your information, whether in more firm ways or more precise ways, or more or less verbal, more descriptive, less descriptive, more friendly, less friendly. Why not? In a way, think about it that you have a tutor in front of you, basically at no charge, right? That is guiding you based on the scenario. So to me, I do use it. And I use it mostly when I provide patient counseling sessions, and I prepare in advance based on the topic that I have to discuss with the patient. Um, it took a lot of bravery out of me because I realized how many things I would have done differently when ChatGPT put it together for me. But having options that perhaps may not be readily available to you, I think it's a blessing rather than looking at it in a critical way. Next. So what's the take home? Take home messages that before we move on is that take home messages that AI I should stop using will. AI is finding its way even in those specialties of medicine that are very sensitive, very private, very intimate. And the key is, I want to be very clear, not to tell you how you treat, but in cases that we've reviewed, how to better communicate. And I don't think anybody can, but you can try, convince me otherwise that communication is one of those tools that being effective at is absolutely critical despite of where you're going to end up in your career in clinical medicine and academic medicine and research, because we all have to communicate and not just via quick text messages, but nothing is better in life. And I do say it openly and with my full heart, nothing is better in life than human to human communication. And while I don't want to sound sentimental, COVID years that we all went through have taught us, if nothing else, but then, you know, being people to people, communicating people to people, experiencing those emotions are priceless. So let's cherish those and fine tune if and when it is possible. Some of you will go into the more societal aspects of healthcare delivery, public health, epidemiology, global health, travel health, because our world, no matter how much we say, it's actually pretty small. And people travel and people exchange data, and you get data pretty much around the globe in a matter of minutes. So you're going to find the artificial intelligence at your fingertips when you also have to compare, and you will have this need when you have to compare healthcare systems either between the continents or between the countries or even within the United States. That are differences in how care is being delivered from state to state, from city to city, from city to urban, from urban to suburban, from suburban to rural. So this is not some kind of a hypothetical would be, could be, should be. It is part of the medicine, part of the epidemiology and global health. So AI can help us with data. Uh, um, Somewhat reflecting what Alex said earlier, let's quickly gather the data rather than spending months and years of gathering data. And if you're going to look at research that has been done, clinical research or epidemiological research or pharmaceutical research, there's a reason why it took on average 10 to 15 years to develop new drug. Not because people were smarter or dumber, but because gathering data and analyzing data was the hardest and the longest process, identifying variables. So if you can do the same thing, but shrink the preparatory component and shrink the timing with the same accuracy, if not better, with same precision, with fine-tuning what variables you want to combine in your research, in your analysis, why not? So that's another way why AI will be and is already being used in clinical and epidemiological research. And this is not important. This is important, pardon me, not only for the clinical medicine. This is important for policies. So some of you will go into the delivery, the administrative and political and business and operations and policy decision making behind healthcare. There are courses specifically designed for that, how AI supplements healthcare policy decision making. So, and again, I know I'm repeating myself. So, the beauty of being trained for the degree of physician, it is because it has a implementation in so many careers around you. While this lecture is not on careers, AI certainly incorporates how you can navigate different careers and still gonna end up sooner or later utilizing on daily basis AI. Next. We can skip. So, whatever I've been saying for the last like 40, 45 minutes, somewhat summarized in this slide. And I'm using infectious diseases, number one, as an example. Number one, because A, it's my specialty, and because it's probably the best investigated medical specialty in terms of incorporation of AI. So when you're going to think of AI, what's the beauty of the slide? It has four different quadrants. How you incorporate individual data with environmental, aka biological, social data around you, which may or may not be in your control, right? Remember, even though we as physicians always believe that we have everything under control, life is different, and we're constantly being reminded that not everything is in our control. If anything, pretty much nothing is in our control. So our job is not to control the control. Our job is to mitigate the risks and hopefully complications. So how you put together your individual patient mindset, which should be the focus at your level of training, right? You need to learn about patient X as comprehensively as you can, because next time you're going to see the same patient with the same problems not same patient, but patient with the similar problems, you already will have your algorithmic mindset. But how you also incorporate environmental and social data with patient data, how you incorporate data with global microbiological data, which may or may not be in your control, and how you incorporate data from the genetics, which is the 4 slides. But if you think about it, this kind of parameters can be applied to different subspecialties in care. They may not be called infectious diseases, they may be called GI, but concept is the same. So my invitation to you is when you're going to start, and you will, or maybe you already is, or using AI in your everyday practices, think of individual patient, think of the group of patients. It's sort of speaking when you start your research portfolio, you start with case reports, then case series, and so on and so forth, and double-blind studies, epidemiological studies. Learn from individual to the large, and that's where AI might help you as well. Next slide. Next slide. Next slide. Next slide. Okay, so the last portion that I would want to address is pharmaceutical development, which has somewhat started briefly, but it is mind-blowing how quickly pharmacological and treatment and preventive pharmacological options are changing. I can tell you about my specialty. On average, I have to learn about maybe 2 to 5 new treatment options and 5 to 10 new diagnostic tools in my specialty, pretty much on a monthly basis. Um, while it's important to have a foundation, and obviously nothing is better than having very strong foundation of knowledge, what you need to be aware of, but how do you keep how do you use AI in pharmacologicals, and why would you want to do that? And I'm only going to give you a specific example. If you recall, I said it earlier that, AI on average, without AI, it took about 10, 15 years to develop a new product, new product or new device, new technology, surgical technology. Right now, we're down to 4 to 5. And the key is because in the middle of the slide, if we only talk about the development of antibiotics, even putting together the antimicrobial activity assay, in old days, it would take you between 5 and 7 years, just to give you a perspective when you start analyzing all antimicrobial resistance. Next, next, we can skip. So let me touch on this, kind of going back to what Alex said before. Yes, it is absolutely helpful using AI in whatchamacallit, in literature review summaries, right? So you could have it at your fingertips when you're rounding. But I want to be very clear. There are still a lot of, I'm going to use the word scam intentionally, or inaccurate data. That sounds very sophisticated, except that this is completely false or non-existing data. So my invitation to you is, we can move on, next slide. My invitation to you is, while it may sound very legit, very appropriate, very thorough, very scientific-ish, we are still not fully at the level of utilizing AI software that perhaps has not been fully studied. Again, while I do not promote one versus the another, but there's a reason why UpToDate has been so up-to-dated and has been so broadly used, because data has been validated. So my invitation to you is, if you want to do let's say fellowship in medical communications or medical publishing, validation of data is something that actively is being undertaken. In other words, how do you know what you're looking at and what you're reading is legit, is accurate, is valid, and it truly has been published, and this journal and manuscript actually exists, and these authors actually exist and not fake. They already have been cases, even lawsuits, when people have been utilizing articles which simply not accurate. So do be aware of it. Again, you cannot be perfect from the day that you're born, but that's why AI is evolving. Next slide, please. And we can move on. And the question is, we can move on. The question is, yes, for sure, that ChatGPT are used often, even when writing notes, and it's great. Except the fact that if you edit the notes that are written by a robot, you're still gonna find a lot of nuances requiring validation or editing for this or that particular patient. So look at it as a excellent secretarial source when somebody is typing what you say, but you still, at least at this point, has to do validation of your notes, validation of your literature search. We're not at the stage of completely trusting what's being recorded on our behalf, so just be aware of that, okay? And the we can move on. Um, and let me finish with this slide. Intentionally. This is a slide that has been actually developed, if I recall, by scientists at Stanford, that obviously is a prominent academic center researching on AI. So not often, and I'm going to repeat myself, not everything that you see will be true. That's why there's a lot of overlaps. That's why you see even the slide itself not very clear. So let me summarize or come up with the conclusion of the presentation is AI is here. It's evolving. It's not perfect. And it's up to us to lead. It's up to us to be curious, and it's up to us not to be afraid, and it's up to us, as physicians particularly, to trust only after we verify. Okay, just like when we do patients' history and physical, it's a subject to more or less validation, right? How do I know what's presented in front of me is appropriate for me to analyze or to utilize? So if that's your mindset, questioning yourself, um, but utilizing resources that are available to you and the software, then you're definitely on the right path. And I know I'm repeating it, but also intentionally, do not wait. Do not put into the tomorrow to start about learning and pushing yourself towards the EI. That's my personal invitation to you. And I'm very thrilled to be invited here and to share some thoughts that I've been experiencing, and look forward to hearing from everybody in many years of the amazing research they've done in this field, and certainly happy to, when it's ready, to share more on how AI actually changed me personally, but that's not going to happen for the next few months. So let me get back to Alex. Happy to take any comments, any thoughts, any disagreements, any feedbacks, any suggestions, and we'll take it from there.
Awesome. Are there any questions or comments? Okay, awesome. Well, thank you so much for coming. Thank you, Dr. Price, for giving this lecture today. We really appreciate you giving back to the current clinical student body and providing some insights that we're definitely going to need going forward as we progress into our careers. We really appreciate you taking time to contribute to the Rounds with the Council series. And thank you again for coming, everyone. Have a good night. I'll go ahead and stop the recording now.
Have a good night, everybody. Be well, be safe. Bye-bye.